Welcome to TechNOW. I'm John Reid, host, CEO of CATA Alliance, and we're joined today by our David Farnes. David has been leading our healthcare initiative, and we've just finished publishing a submission on, it's called, David, Mobile Healthcare in Canada, Turn Up the Volume. So what's that all about? Why do we have to turn up the volume?
Well, John, thanks very much for the opportunity. As you know, awareness of mobile health in Canada and adoption of mobile health in Canada is relatively low. And we launched our Mobile Health Advisory Board a little over a year ago with a focus of turning that around and driving adoption in Canada. And we were working with our board members, able to submit a short brief, a 5-page synopsis of our thinking around mobile health to the advisory panel on healthcare innovation. This is an advisory panel that Minister Ambrose struck back in June. So this is really a good opportunity for us to get out our messaging around mobile health.
Well, I know you have quite a large social network giving you input and guidance, but who is on your board? Who actually is helping you, create this footprint going forward, making Canada a little more innovative when it comes to mobile healthcare?
What's interesting about our board is we've been able to bring together people from across the ecosystem. So we have representatives, senior representatives from Bayer Canada, TELUS Health, CGI, University of Ottawa. We have representation from the long-term care facility organization in Ontario. We have the former CTO of the Canadian Medical Association on board. And we've even drilled down and we have individual practitioners on board.
Well, what we'll do with the description of this interview, we'll include the link to that social media group. But I've always been very interested in the online booklet you're developing, dealing with new applications. Maybe you could just close TechNOW by telling us a little bit about that marketing, promotion, advocacy for new technologies. What is that all about? And if I'm an innovative company, how do I participate?
Oh, very, very good question, John. So, in our little brief that we submitted to the advisory panel, they really asked 5 questions and they wanted a 5-page response. So there wasn't a lot of opportunity for us to present evidence and case studies to the panel. The lack of evidence, the lack of awareness is a priority issue that our advisory board identified. And so we've been working to put together profiles of players in the mobile health space in Canada, including compiling this living book of case studies. I like to call it a living book of case studies that's online. We refresh that quite frequently. And it's really a great opportunity to showcase innovation in Canada and to share best practices. We do interviews like the one you and I are doing right now and try to capture guidance from experts in the field as to how people should bring their mobile health solutions to market. So that's available online at cata.ca/MHAB. MHAB for Mobile Health Advisory Board, and you can see that living book there. Check our, you can certainly contact me or check our news releases to find out how you can add your profile to that database of innovation.
Well, David, thanks for joining me this afternoon. I like the fact you've left with the call to action. We like to see many more case studies as part of that living book that you're talking about. And again, we appreciate your leadership in advancing mobile health care in Canada.
Thank you, John.